for reminding us why we do this work and why this is so important. Thank you. Hello, good morning. My name is Peggy Toy. I direct the UCLA Smoke-Free Air for Everyone project at the UCLA Center for Health Policy Research. I'm excited today to present findings from our survey of tenants and landlords in the city of Los Angeles. These surveys inform the development of the Smoke-Free Apartments LA Education Initiative that we're launching today. Our aim is to close the gap in protections against secondhand smoke between those who are protected and those who are not. Our target area is the city of Los Angeles, where nearly half of all Latinos and African Americans in low-income neighborhoods live in multi-unit apartment buildings. Many of these apartment residents include those who are most vulnerable to secondhand smoke, children, the elderly, and those with chronic health conditions. Our geography. We specifically surveyed residents of apartments in central and south portions of the city, between downtown on the north to Slauson Avenue on the south, and from the east on Main Street to Robertson Boulevard on the west. These are some of the most densely populated areas of LA. We also surveyed a sample of the members of the Apartment Association of Greater Los Angeles, as well as other apartment owners. Our goal was to understand tenants and landlords' experience with secondhand smoke and their views on smoke-free apartments. For example, we wanted to know whether tenants would prefer to live in the non-smoking section of a building or whether they wanted to be in a completely smoke-free building. We wanted to get a sense of whether secondhand smoke drifts into people's homes and whether people have a medical condition that could be exacerbated by living near smoke. We also needed to know if there are any existing smoking policies in place in the building. Project partners, CD Tech and Fame Corporation, community organizations that provide services and programs in the target area, conducted nearly 1,000 door-to-door tenant surveys this past summer. From these surveys, we found that 80% of apartments do not have smoke-free policies. And 1 in 3 renters report tobacco smoke drifting into their apartment from another apartment or through a common area. 82% of tenants said they would prefer to live in a smoke-free apartment. And renters who smoke were even more likely to support a smoke-free policy. 85% of renters who smoke said they prefer to live in a smoke-free apartment. More than half of households with children or chronic health conditions reported smoke drifting into their apartment. Although 2/3 of these renters attempted to block the smoke from entering their apartment, less than 1/4 report the smoke to their landlord. What this means is that the landlord was not made aware of the problem, and the children and those with chronic health conditions were suffering in silence. Disparities. Both Latinos and African Americans suffer high rates of illnesses related to secondhand smoke, such as heart disease, diabetes, lung cancer, and asthma. Yet our study revealed that minority populations in general were disproportionately exposed to secondhand smoke. More than 30% of Latinos and African Americans in the survey reported smoke drifting into their apartments, compared with 26% of whites. Landlords. In our ongoing survey of landlords to date, the Apartment Association of Greater Los Angeles has conducted surveys of 93 apartment owners representing over 5,400 units in the city. Initial results from the landlord surveys indicate that most properties are not smoke-free, but property owners are supportive of smoke-free policies. More than half of landlords with smoke-free properties reported support for such policies. Among the reasons they gave is the value of a healthy and clean environment for their tenants, lower maintenance costs, and the marketability of smoke-free units. 65% support smoke-free enclosed common areas, 56% support smoke-free outdoor common areas, and 62% support smoke-free units, including balconies and patios. Now, landlords without smoke-free properties also were supportive of these policies. Specifically, 72% support smoke-free enclosed common areas, and more than half support smoke-free outdoor common areas and smoke-free units, including balconies and patios. So if tenants and landlords want smoke-free apartments, why aren't more apartments smoke-free? Tenants and landlords need better information. A significant finding for both tenants and landlords is that they lack information on how to make their apartments smoke-free. Even landlords with smoke-free policies are unsure how to make their buildings completely smoke-free. In general, the results of these surveys tell us three things. One, most tenants, including those who smoke, and many landlords prefer smoke-free apartments. Two, children, families, and the elderly living in apartments need protection from secondhand smoke to eliminate health problems like asthma, heart, and lung disease. And three, community outreach and education are needed to assist landlords and tenants to go smoke-free. I want to thank Dr. Ying Ming and the evaluation team for their support and issuing the report. Dr. Ming is co-director of the Center's Chronic Disease Program, who leads evaluation at the Center for UCLA Smoke-Free Air for Everyone project at the center. I also want to thank CD Tech, Fame Corporation, and the Apartment Association of Greater Los Angeles, staff and volunteers, for their tremendous work in conducting the surveys. I also want to thank Esther Schiller, founder of SAFE, who contributed to the development of the surveys and their implementation. Today, we are launching Smoke-Free Apartments LA, a public information and awareness initiative working with community organizations to give tenants and apartment owners the information they need to go about making their apartment smoke-free and how to make it happen. Marlene Gomez, the project manager for Smoke-Free Apartments LA, will give us an overview of the initiative. Marlene.